on Ebola to serving on the front lines of COVID-19 response. He has led national and international analysis of key issues and advised local and federal policymakers around the world. Dr. Jha has published nearly 300 original research publications in prestigious journals and has consistently been ranked in the top 1% of most cited researchers. In March 2022, President Joe Biden appointed Dr. Jha as the White House COVID-19 response coordinator, describing him as, quote, one of the leading public health experts in America today. Dr. Jha has led the work that increased the development of and access to treatments and newly formulated vaccines, dramatically improving testing and surveillance, facilitated major investments in indoor air quality measures, and put in place an infrastructure to respond to current and future disease outbreaks more effectively. We are in awe of Dean Jha's many accomplishments, and we are very excited to have him back at Brown. Tonight's event is meant for us to get to know our dean on a more intimate, personal level. He does know this, and get to know how he became the formidable leader that he is today. So welcome, Dean Jha. Thank you for spending some time with us, and we're excited to have you.
And thank you. And that all feels like too much, to be perfectly honest. But that's very kind. And I realize that is my bio, but look, what I'm going to try to do with all of you guys is talk very openly, both about, and I'm going to speak hopefully for no more than 5-7 minutes about my life, how I got here, where I grew up, what I did. And maybe during that conversation, try to highlight some things that I think are principles and ideas that may be useful to all of you. So, and then we'll have a conversation, and we can go wherever you all want. And we have till about 7, right, Jen?
Right.
So we have a good 40 plus minutes. And again, I'm sorry, I'm a little bit late. So very quick, like life story. I was born in India. I was born in Bihar, which is the poorest state of India. I left when I was 9. That was not my decision. It was my parents' decision. They decided they just wanted to do what a lot of immigrant families do, which was to get out and give their kids, I have an older brother, my brother and I, an opportunity to do different things. So we first moved to Toronto, then moved to New Jersey. And I went to high school in New Jersey. I went to college in New York. And New York was sort of my first real formidable experience. I went to Columbia. Really, I was an Indian American kid. I learned English when I was in Canada, got better at it when I was in New Jersey. But it was at Columbia that I really started thinking about issues of identity. And actually, one of my closest mentors, probably my closest mentor at Columbia, was a guy named Michael Paley, who was the rabbi who ran and oversaw the religious community at Columbia, and learned a lot about what it means to both be American and while still keeping your original identity, something that I think has been a very important part of my life in thinking of myself as an Indian American. Like, you can be very American, you can still be an Indian American, and those are not contradictory things. And I think there are a lot of us who juggle with multiple identities, and just a sense that this is a country that allows you to have multiple identities, and you don't have to apologize for it. You don't have to explain it. You can feel authentic in whichever set of identities you decide you want to own. From college, I went to medical school. I came up to Harvard, and I went to medical school at Harvard. Did my residency training out in California. And, when I was in medical school, I did some research. I took a year off and did research, kind of health services, health policy research, loved it. And then did more of that when I was a resident. And actually, also during my year off in medical school, when I was doing research, I took classes at the public health school. But fundamentally, it was really interesting. It was my first kind of my mini midlife crisis, I'd like to describe it, after residency, where I was like, I don't know that I want to be an academic. And fundamentally, the question that I struggled with was, I felt like there was so much research that people did that just didn't make a difference in the world. And I wanted to make a difference in the world. I did not want my life to be, how many papers have I published? how many grants have I gotten? What is my highest academic title? I really wanted to ask the question, like, how have I moved the needle on things I care about the world, the quality of care people get, the costs, affordability, issues of disparities. Those were the things that I was really interested in. I spent a couple of years after residency working at the VA, really thinking about how do you make that health system better, and realized I didn't quite have the set of skills I needed. So I came back to Harvard, got an MPH, which also gave me a lot of training in research methods, and decided even if research wasn't going to make a big difference in the world, I liked it, I wanted to do it. And actually one of my mentors said to me, you know, your challenge is to try to do research that does make a difference. Try to think about what are the questions that action takers, policymakers want to make, and how do you feed them data and evidence so that they make better decisions.
Mm-hmm.
And much of my early career, even my mid-career, I would say I spent a lot of time in Washington because I was interested in health policy. And I spent a lot of time down in Washington meeting with policymakers. And I would share both the analysis I was doing, but then I would, at the end of it, ask them, what are the questions that keep you awake at night? What are you worried about? What do you think are the big pressing issues where you don't have evidence, where you don't have data? And I would always get really interesting research questions from those. And then I would come back home and I would actually do the research to try to answer those questions. So I was always very motivated by the idea that my research should matter to somebody who then can use that data to make better decisions. That was the idea. I did that at Harvard as a faculty member. I started as a faculty member in 2004. I did that for about 10 years. And then in late 2014, got a phone call. And one thing I will say that I learned in that time period, by the way, which I think is a really important lesson, at least has been for me, is there are going to be many times in your career where you're going to be faced with a choice of like, what job do I want to take? What path do I want to go down? And the one piece of advice that I got, which I thought was extremely helpful, and I definitely used it for my own decision-making, was, you know, somebody said to me early on that the biggest predictor of job satisfaction is not what you do, it's not your title, it's who you work with on a daily basis. And I remember saying to them, yeah, I can imagine why who you work with matters, but how can it be more important than what you do?
Mm-hmm.
Like, what you do has got to be the most important thing. And this mentor of mine was like, it's not even close. It's who you are with and it's who you spend with that actually determines happiness. He was completely right. At least for me, he was completely right. Now, that may not be true for you, but for me, that was completely right. And so all along the way, as I would pick research projects, I would ask the question, is this somebody I want to work with? Is this somebody I'm going to enjoy working with? And that meant that sometimes my research career kind of looked like it was zigging and zagging a little bit. But I felt like as long as I was working with people I enjoyed, I didn't care. In late 2014, I became the head of the Global Health Institute at Harvard. At that point became when I met with the university president and we talked about what the Global Health Institute should be. Drew Faust, who was president of Harvard at the time, said, look, I want you to think about what are the biggest pressing issues facing the health of the world's population that we as a university and we as a broader community are not working on. And it was pretty clear at that point what some of those issues were. And I remember laying them out to her in a conversation in 2014. I said, you know, and I'll give you some specific things I did around this. At first, I said, look, we are at a real increased risk of a global pandemic that we are not paying attention to. The risk of pandemics is growing over time, and most people are not aware of it. And we have got to start working on making the world more resilient. Second, related but different, is that climate change represents the biggest public health threat over the next 10 to 20 years. And there's a lot of work to do there. And then the third is the explosion in data science and AI That is really going to reshape public health. So those became the kind of agenda items of the Global Health Institute that I ran. And it was great. And we were working on a whole bunch of stuff. In 2015, I had a course I put together online, which you can probably still find, called Lessons from Ebola, Preventing the Next Pandemic. The question I would ask everybody, it's been, as you might imagine, some of the misinformationists out there and the conspiracy theorists have actually found this video and think that I was some part of some global conspiracy to create COVID-19 to spread to the world. I can assure you I was not. But the question I would ask I had a whole series of experts in that class, and I asked every one of them a question at the end. The last question after a discussion I would say to them is, okay, imagine it's 2020. Imagine we have a global pandemic. There's a virus. It's maybe from China. Is the world ready to respond? And I can tell you, by the way, why I asked those questions. It wasn't like I was brilliant or prescient at all. And everybody would say, no, we're not going to be ready to respond by 2020. And the reason 2020 was just a random year. It was a round number. So that's why I picked it. We all knew a pandemic was coming. It was almost surely going to be a virus. Most pandemics are, not all, but most. And China, because of the explosive economic growth, the explosive globalization, I could have picked India. I could have picked the US as the source. But most of us were worried about China. We were actually not worried about a coronavirus. Most of us were worried about a pandemic flu. But as you can imagine, a lot of people have found that video from 2015 and said, how did this guy know? Maybe he was part of the global conspiracy to create the virus. Anyway, so that continues. And I'll just finish up by saying, over the next few years, I looked at a bunch of dean jobs at a bunch of different schools, and ultimately was not sort of feeling like this is what I wanted to do. And then in 2020, in January of 2020, then the provost of Brown reached out and said, we have an opening to be dean of school of public health at Brown. Are you interested? And I said, I'm not. And he said, why not? And I said, I don't want to be dean. Like, I'm young and I don't like being a dean of a school is like a lot of chicken dinners with donors on, like that's just not that interesting. Like I'll have dinner at home with my family. And he said, well, let's just get together for coffee. So I got together for coffee, and this is really my last story. Well, I have one more. I'll kind of finish off a little bit further than that. But, so we get together for coffee, and he said, like, what do you want to do if you don't want to be dean? And I said, Rick, like, there's just so many big problems in the world. And we have got to make progress on those problems. And being dean is like, it's a being job. It's not a doing job. And I want to do stuff. Like, I don't want to sit around and like preside over meetings and sit in faculty meetings. And like, it just seems incredibly boring to me. And he said, what if you had the chance to build a very different school of public health? Like a good school of public health that's doing interesting stuff, you could rebuild it and really make it a school that tackles the big stuff. And I said, well, that's interesting. I was like, and he said, well, I got a school that is open to that kind of change. And that got the conversation going. And I laid out my agenda. This was January 2020. I was like, we got to work on pandemics. We got to work on climate change. We got to work on data and AI. We got to work on broader issues of health equity. And he's like, I'm in. Led to more conversations. In early February of 2020, I signed on. And then you guys all know what happened in between February and March of 2020. Last point is in 2014, I co-chaired a commission, an international commission, that looked at why the world responded so badly to the Ebola outbreak of West Africa. And it was an international commission. I co-chaired it with a friend, well, now became friend, but the guy who was the dean of the London School of Hygiene and Tropical Medicine, a guy named Peter Piot. And we put together a report. And it was a pretty hard-hitting report. We did not pull punches. We're like, here's how all the ways WHO screwed up. Here's all the ways like different governments screwed up. And we were very clear. And then we gave a bunch of solutions. And that report, we published it, but that report found its way into the hands of a guy named Ron Klain. And Ron Klain had been the Ebola czar for President Obama. And Ron called me after he read the report and said, this is the first like cogent, clear, non-bureaucratic, not like, we all must strive to do better. He's like, not nonsense, but like very specific things. So he's like, thanks for writing it. I was like, yeah. And so then I met Ron a few more times. We chatted a bunch more times. And in 2020, when the pandemic broke out and I was doing a lot of television, Ron started calling me and saying, I'm involved in the president's campaign, or that wasn't the president at the time, Joe Biden was a candidate. I'm involved in Joe Biden's campaign. And I just started kind of offering informal advice, nothing serious. I also was doing a lot of advising of the Trump White House. I can assure you that they listened to almost nothing that I was actually suggesting that they do, but they kept calling, I kept giving them advice, they kept ignoring it. And that went on for much of 2020 and 21. And then in 2022, I got a call one day from Ron. He was the president's chief of staff. We were talking about COVID. And then he said, would you ever consider coming to work in the government? And I was like, I really believe in public service. And 2 weeks later, I got a phone call from the White House saying the president would like to meet with you. So when the president of the United States wants to meet with you, there's only one answer. So I went down, met with the president. He asked me to take over the COVID response, and the rest is history. So that is my long story. I hope that wasn't too long.
No.
Last kind of point, not a story, is, in retrospect, and even the way I tell it, it sounds very linear, like I did X, then I did Y, then I did Z. I can assure you that at almost every one of those steps, I was like, I don't know what I want to do next. Where do I want to go? What's the thing I want to do? What do I need training in? And I think if any of you are sort of feeling that way, like, boy, he seems to have he had this whole plan figured out. I did not have it figured out. I can literally at any moment, if you ask me what is next, I would have been like, I have no idea. I'm struggling. I have principles and I'm happy to talk about them. You've got to be willing to take some risks. Again, go with people more than the project. Building up your own training is really always important, and investing in yourself is really important. Working on really important things, even if nobody else cares about them because you think they're important, is really important. So there's a set of things that I can look back on and say, I think those things were helpful. But it was not linear. It didn't feel linear in living my life. Hopefully it's not done. We've got more to do. Didn't feel linear as I was doing it, but it does feel very linear when I look at it. So in retrospect, so my point is, if you look back at your career and think, oh, I have not had such a linear career, I would not worry. There's lots of zigs and zags that when you look at it in retrospect, looks like a straight line. There were a lot of zigs and zags. Let me stop there.
Thanks, Ashish, and thanks for saying that, because I think we've all been there where it's like, am I on the right path? Did I join the right program? Did I, so I thank you for being upfront about that. Because I think when we do look at your CV, when we do Google you, we just think that we just assume that you just knew from the beginning that you were going to get to this place.
Absolutely not.
So I did want to turn to, we do have student moderators that have prepared questions for you. We've also already fielded questions. So I'm going to turn to Amelia and to Anissa to, maybe you did talk a little bit about your childhood. You did talk about a little bit about your background, but they may want to just ask even a little bit more probing questions if that's
Ask me anything you want.
Okay.
Ask me anything you want.
Yeah, I will just say we'll ask our students to also just introduce themselves and then ask questions so you know them a little more.
Awesome.
Yeah.
Yeah, I can introduce myself. I'm Amelia. I'm one of the online and PH students from the fall 2022 cohort. So, the start of all the online stuff. And I'm also part of the Graduate Student Council, as most all the moderators are. And I think I speak for all of us when I say that it's very wonderful to virtually meet you and get the opportunity to talk to you. We appreciate that you are joining this call and letting us kind of get to know you a little bit more.
Absolutely. So. And I hope that we get to actually meet in person at some point, because that would be a lot of fun.
yeah, hopefully we can plan an event where, you know, the online students can all rush campus or something like that.
Yeah.
But yeah, so if you talked a little bit about, you know, where you grew up, but the question I have is, you know, when you were growing up, did you see yourself in public health? I know you were talking about how you have like a zigzag career, so could you elaborate a little bit more?
I will tell you, until I started, like, when did I first think I was going to do public health? Probably as a medical student, when I was taking time off to do research. I started taking some public health classes. That was the first time the idea of public health ever crossed my mind. I will admit some things that I probably should not admit, but I will admit them. I went to medical school for all the wrong reasons. I went to medical school because my parents really wanted me to go to medical school. I did not want to really go to medical school. But my mom was like, you know, she had 2 kids, an older brother and me, and she wanted one of her 2 sons to go to medical school. And my brother was like, nah, not interested. So it was me or bust. And so to please my parents, I went to medical school. Turned out I actually loved it. So I wasn't quite expecting that. But I had been in like an economics major in college. I'd done a lot of human rights work in college. I thought I was going to like maybe go to law school or public policy school. And here I was in medical school, and I started taking public health school classes. I was like, oh, this is actually a nice mix of like thinking about policy, thinking about broader societal issues while still focused on health. So did I know growing up? Absolutely not. Not until my first encounter with public health did I think, this is an interesting possibility.
That's very good advice, because I know for myself, especially, I didn't see myself in public health either, and that can be very intimidating being in public health now. So I appreciate that, hearing that from you. And I'll turn it over to one of my other peers.
Awesome. Hey, Dinja. Just want to say thank you for your time. It's nice to see you virtually. My question for you is, I know you spoke about being from India, but what role do your other intersections play in your decision to be a doctor and enter the public health field? Are you a father? Are you a husband? How do these different roles that you occupy influence?
Yes, I am a father. I am a husband. I am, as I said, obviously Indian American. I'm an immigrant, you know, first generation immigrant. It's hard to tease apart. I mean, obviously I went into medical school and public health before I became a father or a husband. I married my wife. I met her when I was in residency. But I think my experience growing up reasonably poor, seeing some of the struggles my family had with accessing healthcare, absolutely shaped my thinking about the importance of making sure people have access to health services and healthcare. And when I was in medical school, really realizing that there are these broader social and systemic issues that really shape health that you can't really control in the clinic or in the hospital wards, is what pushed me to go take classes at the School of Public Health. And I think my experience growing up as a immigrant kid from India definitely influenced that.
Absolutely. Thank you for sharing that. I guess I'll move on to our next moderator. I don't know who that is. I guess we'll just pop.
It's me. Good evening, everyone, and Dinsha. It's so nice to meet you all virtually. I met you in person during the orientation.
Yes, you did. Yes.
Yeah, where we have lunch together. So let me introduce myself. My name is Saraj Leilati, internal medicine physician and the second year online MPH program. I also serve as the co-chair of the academic affairs at the Student Council. To your point of having like the people surrounding you is sometimes better than what you are doing, I want to share my appreciation and gratitude to all the members of the online MPH program, because they have the big effect on transitioning my career to the academic field, where they support, they facilitate, and give me the opportunity to be doing my internship at Rhode Island Department of Health and being part of the public health community as a TA at epidemiology course and a member of the community health curriculum committee. So I do really appreciate all their efforts. And sometimes, yeah, really, it's more important to be surrounded by the people rather than what you are doing.
Totally.
Yeah, thank you all. To my question, you already actually discussed your way through being the Dean of the Public Health, but maybe do you have like any instrumental pathway that shapes your path to this leadership role? Any accomplishment that led to this leadership role?
You know, what I will say is leadership opportunities come at unexpected moments, and it is hard to both predict when they will come or try to kind of will them to come. Like sometimes we're like, okay, I really want a leadership role now. That may or may not work. But there are things you can do to create the environment for it, right? So I think obviously it's one interesting phenomenon of life, and this is very important, I think, as a career issue, is if you're good at, like, there are people, all of us do lots of different things in our professional lives. It is really, really important that you do at least one of those things very, very well. The people who I think really struggle are people who are kind of mediocre at 5 different things. If you are terrific at one thing, even if you're kind of mediocre at a few other things, and that one thing can be research, it can be communication, it can be writing, it can be teaching. If you're good at least one thing, the world like looks to you and says that person is effective, and that I think creates opportunities for leadership. So for me, it was primarily that I was a good researcher. I wrote a lot of papers, I got it into the top journals, and that was, I think, what drove people to be like, oh, you should run the Global Health Institute. And then there, we'd really focus on a couple of specific things that I think led people to think, well, maybe you should be the Dean of a School of Public Health. My point is that you should, in your portfolio of activities, think about, not that you need to be excellent at everything. I just think that's unrealistic. I mean, it's great to be like, you know, there's some old advice, if you're going to do anything, do it really well. Like, I just think that's too hard of advice to follow. Like, there's just lots of things I do very mediocre. But I try to think about, like, what is my main mission, my main job, and how do I do that really, really well? And when you do, in unexpected moments, leadership opportunities will come forward to you in a way that you can decide whether you want to take them or not. But it is really important that you're executing on at least one thing at the highest possible level that you can.
Yeah, absolutely. Thank you. And do you face any challenges in bridging like polarized perspectives around like the vaccine and COVID-19 in general while you were like in your role as a COVID-19 coordinator in the White House?
Yeah, I spent a lot of time thinking about this whole issue of polarization and how do we get people, how do we make certain things less polarized, right? There's a series of issues that have become extremely polarized. We're just a polarized country right now. I have obviously no magical solutions. For me, I think the way forward is through one-on-one conversations. I think all of us have to sort of make a commitment to try to be agents of depolarization. That means, you know, what I find really remarkable is how much vilification we do of the other side. So we take people we don't agree with and we think of them as evil, as bad people. I mean, there are evil and bad people, don't get me wrong. Like neo-Nazis, evil, bad people. Like, I'm not really interested in figuring out, like, but most people are not neo-Nazis. I shouldn't even use that example, but you get my point. There are extremists that like, but most people that you disagree with, that I disagree with, are actually good people who just see the world very differently. Does not mean you have to agree with them, does not mean you have to do what they say, but it does mean that you have to see the humanity in people. And once you see humanity in people, if you can find a way to connect with them, and if we can all decide we're going to work on connecting with people that we don't always agree with, that I think begins to reduce polarization. I hear a lot from people about, oh, the other side is polarizing. The other side is not interested in dialogue. Like, that doesn't work. So you got to begin with yourself and ask the question, what are you doing to reduce polarization? What are you doing to try to bridge gaps with other people? That's the only way forward on this. Otherwise, we just become a more and more polarized country. And I don't think and a polarized world, by the way. This is not an America only phenomenon. And I don't think that leaves us better off.
I think. Sarah, you're still on mute.
Sorry. Yeah, thank you so much. So we do still have like around 10 minutes. So I'll loop it over to Oyen to go through the question and answer we have received from the students.
Hi, Dinja. Nice to see you again.
Nice to see you.
For everyone else, my name is Oyen. I am also on the Graduate Student Council. I do communications. And so you've probably gotten a bunch of emails from me. And as for some of the questions that were sent in by students prior to this event, I think over the past couple of weeks, one of them is, how do we bring back trust in our healthcare providers, considering it's definitely gone downhill over the past few years, especially?
Yeah, it's a very good question. It has gone down some. I still think healthcare providers are among the most trusted people in society. Look, trust in all institutions have gone down. Trust in universities have gone down. Trust in government is way down. Trust in media is way down. Trust, like, the military remains one of the most trusted institutions, so that is also declining. And then trust in doctors and nurses as a group is going down. But I always remind people that even when people say, I don't trust nurses or doctors, well, first of all, no one says they don't trust nurses. It's usually doctors. Nurses are still very well trusted. People still tend to trust their own doctor. And so I think it is very important for physicians, nurses, other healthcare providers to talk to their patients about, like, what are your concerns? What is holding you back? You know, a lot of trust building is about listening. And we often think that trust is about, like, going and give people good information and getting them to trust you. Trust begins by trying to ask people what's on their mind, what are their concerns, what are their issues, and then listening and then trying to meet those needs. And I think we've got to do a better job of training our providers to do that. But I do think rebuilding trust in the professions in public health is very possible, but it's going to be a slow process. And it's going to begin by listening much more than it is about telling people what we think the right answer is.
Ashish, I really thank you for that. Ashish, I just wanted to bring it back to leadership. When you mentioned, you know, you wrote hundreds of research articles and that made you a great leader. But I also think there's certain characteristics that you have that make you a great leader. And I'm wondering if you could share with us, what are some of those characteristics that you think would make that leaders should embody to lead, for people to listen, to lead people?
So let me be very clear. I don't think, like, writing hundreds of papers makes you a great leader.
Okay.
And I don't know if I'm a great leader, but I will say this, which is I'm willing to take risks. So almost all of my research was on the domestic side. I was a domestic policy expert. And when I got a phone call to run the Global Health Institute, my first reaction was, I'm not a global health guy, I'm a domestic health guy. But as I talked to the university provost and the president, I thought, like, you've got to be willing to take risks. You got to be willing to fail. You got to be willing to try new things. And I think it was enormously helpful because it got me into a completely different space. So one of the things, and I think there's a version of that you all are doing by doing this online MPH program. You're taking a risk of, like, saying, I'm going to expand my career into either a new area or reinforcing an area I'm working on. I think that is very, very important. So when I look at my colleagues over the years who are not in leadership positions, or who I think have had less impact, it's because they've always wanted to stay in the safe zone. Like, they know what they do, they know how to do it well. They've been doing it for 20 years. They're happy to do it for another 20 years. That's great. That's not leadership. Mm-hmm. another really important part of leadership is bringing other people along. It is not just taking risks yourself, but thinking about why are you taking the risk? What are you trying to accomplish in that risk? And bringing other people along, because it's impossible to accomplish anything by yourself. Anything worth accomplishing, you can't do by yourself. So when you have a leadership opportunity, thinking about what kind of team do you have, who's around you, who's going to make you better, and who are the people who are going to tell you the truth. So there's a lot of that goes into team building when you're in a leadership role. I have always surrounded myself, and that is certainly true at Brown, by people who have absolutely no problem saying no to me or telling me that my ideas are terrible. I have a lot of ideas every day. And I have for instance, both a chief of staff and an executive dean who I'll walk in and say, I have an interesting idea, and I'll pitch it, and they'll both look at me and go, that's a terrible idea. And they'll tell me why. I'll be like, okay, fine, you're right. That's a terrible idea. Okay, we're not going to do that. But you need that, because one of the things that leaders get into trouble is they fall in love with their own ideas. They're like, I thought of this. It's so cool. You want really smart people who are like, it's not as cool as you think you are. I mean, it's not as cool as you think it is. You also may not be as cool as you think you are, but that's a different issue. But the point is, you want to surround yourself. And by the way, that's in a leadership position, but I actually think that's in life. Like, you want to be surrounded. There's a thing that I often talk about, which is I never want to be the smartest person in the room, because like it may be good for my ego. It's bad for my growth. You want to be in rooms where there's a whole bunch of people smarter than you. You want to be in a room where really smart people can say, you know, Jen, that's interesting. Let me give you 3 reasons why that's not going to work. And you may say, no, it is going to work, and I'm going to do it. But you want to have the intellectual challenge of being around people who are going to push you. And I have always tried doing that. In my research career, I've tried doing that. When I was at the Global Health Institute, I had a whole leadership team that it was not shy about saying no. And at Brown, I've hired a bunch of people who are not uncomfortable saying no to me. It makes me better, and it makes our ideas better. And sometimes, every once in a while, I have an idea and everybody thinks it's a terrible idea. I still do it because I think, and turns out every once in a while I'm right, and sometimes I turn out to be wrong. And then everybody goes, we told you it was a terrible idea. I'm like, okay, fine. I had to learn the hard way. But the point is, you still have to believe yourself. Like, you still have to try things, but you want to be around people who are willing to say to you, that's not a good idea.
All right, I'll remember that. I do want to turn it back to the students. I know that there's a few more, and I hope we can just take a few minutes of your time.
Yeah, let's do a couple more.
Yeah, Sarah, did you want to go through the list?
Yeah, so in this day and age, how do you navigate the obstacles around communicating public health information? How do you navigate the fake news and the misinformation, especially on the social media?
Yeah, so look, it's complicated, and there are no simple answers, but I have always believed that at the end of the day, the best way to counter bad information is by spreading a lot of good information. And when I think about how to spread good information, I start with my own family, and I say, what's the advice I'm giving my family? What's the advice I would give my friends? And, you know, when it comes to like vaccines or treatments or what to do on COVID or non-COVID issues, I often begin with, here's what I'm telling my family. I try to speak, when I speak publicly, I think about, I'm speaking to my mother. My mother is smart. My mother's not a health person at all. She was a school teacher in New York City for 35 years before she retired. And she doesn't know anything technical about medicine or public health. But so I always think that's the person I'm speaking to, right? And so I've got to speak in plain English. I got to be understandable, and I got to be relatable. And if I start using gibberish and technical language, my mother's going to be like, what's going on? Why aren't you speaking to me in English? And so just keeping focus on who are you speaking to, and making your advice relatable by talking about how you're living your own life, how you would do it for your family, it builds confidence in people.
Thank you, Ashish. We did have a question from one of our students, Dana DM. The student asked, with rapid advancements in data science and technology, how is the School of Public Health evolving its data infrastructure to meet the dual demands of speed and accuracy in information dissemination?
That's a great question. Look, there's a lot of like work being done on kind of our technology platforms and how do we make that better. There's also a lot of work being done. There are two areas where there's a lot of work being done, and then the third area where we need to do more, and we will be doing more. So there's all the kind of technology stuff we're trying to make improvements on. There's a lot of very good work being done on understanding this kind of explosion in AI, large language models. We've got several faculty who work on that. We're hiring more. But there are two areas where I feel like but every other university is behind on, that we are going to fix over the next year. One is, there's almost nobody out there who's working on what are the practical implications of AI in public health practice. So not like, how do you build better AI models? That's important. There are people doing that. There are people in computer science doing that. There are people in biostatistics at our school that are doing that. But what are the practical implications for how public health practice is going to change? What does this mean for public health workers on the front lines? AI. What does it mean? What does AI mean for the health leaders in states? So I'm right now in the middle of recruiting a faculty person who I hope will really begin to work on that and shape that. There's a second part, which we're not doing, which again, no university is doing, but we need to do, is what are the implications of AI for a university in terms of its teaching? Like in classes, like what's the advice we give to students about can they use ChatGPT? Can they not use ChatGPT? Now we could have a rule like no one can ever use ChatGPT. I think that's a bad rule.
Yeah.
So we have to grapple with the fact that like these tools are getting better over time. Students will be tempted to use them. What are the rules? What are the ground rules? How should we use them? How do we make? So there's a bunch of stuff there. How do we do research using AI? So there's just a set of issues around a rapidly changing technology where I feel like we've made some progress, but we have got to make more. And my expectation, hope, is that over the next 6 to 12 months, you're going to see pretty large investments from the School of Public Health and the university in these areas, because it is rapidly changing, and we want to get better and better at managing these technologies. We're not going to be a leading school by ignoring it and hoping it goes away, or saying, oh, ChatGPT is bad, no one can use it ever. Like, that's just unrealistic. So let's be honest about it. Like, let's figure out how to use it. Let's get people to use it in a responsible way, in a transparent way. And professors don't even know what advice to give students. And so you may be hearing from some professors, no ChatGPT, and others, they may be saying totally fine. Like, let's get some consistency and clarity. There's just a lot of work to do. It's a brand new technology, and I think a lot of us are still struggling with it.
Thank you, Ashish.
All right, one more?
Yes, one more, and then one of our students asked if your views have changed on our public health system since your time at the White House and seeing the effect of politics on it, and do you have some lessons learned that you'd like to share?
Yeah, look, I don't think they've changed much since I went to the White House. And politics is an interesting thing. So actually, let me talk about politics and public health. I think politics and public health is fine. I worry about partisanship in public health, but let me talk about politics. What is politics? In my view, politics is a process by which people with different values, different worldviews, resolve those differences. In a democracy, politics is messy, because the truth is, we're a country of 330 million people. Not all of us agree on everything with each other. That's okay. And politics is the process by which we resolve those differences in a way that lets us function as a country. And so there were times, and without getting into specifics, where there was a policy that I thought was the optimal public health policy. And then, we shared that idea with a whole bunch of different groups. And I was often surprised by who was supportive and who was negative. There were things that I thought were very, very pro public health, and the unions would come out strongly against it. We're like, wasn't expecting that. Or the trade group would come out against it, or they would come out in favor of it. And you can decide none of that matters. I don't care what anybody else thinks. I'm just going to implement it. By the way, that's a terrible idea. Because if you don't bring people along, they will undermine it. And over time, they will destroy it. So you can force policy down people's throats. But if you have not convinced people it is good, it's the right thing to do, over time, they will do a bad job implementing it. They will undermine it. They will push against it. And over time, the policy won't be successful. So the question you have to ask yourself is, do you just want to get the policy accomplished, or do you want to actually make a difference in people's lives? If you want to make a difference in people's lives, got to bring people along. Bringing people along, that's called politics. So I have come to appreciate in a much deeper way that politics is part of public health. It is about meeting people where they are. I mean, there are just times when people are not ready to do certain things. And then you say, okay, well, can we do half that thing? And maybe over time, we can get you all the way there. Some people are like, that's compromise and you're compromising your ethics. I'm like, I'm just trying to move the ball forward. Like, if I were a dictator of the world, sure, I would do whatever I wanted. You don't want me to be dictator of the world. You want me to make progress. Public health is about making progress. By the way, the kind of absolutist view is like the same view that the people who believed in abstinence only, like sex ed, we should just tell everybody to abstain until they're married. Or on substance use, like there's no safe substance use, you just tell people to abstain. Over time, we came to realize like that is not the way the world works. Harm reduction. Somebody's abusing drugs. How do you reduce the harm that it's creating without creating abstinence as the only goal? Some people see that as a compromise. I see that as progress. So the biggest thing I will say to all of you in thinking about politics is, at the end of the day, when you're in public health, no one pays you for moral righteousness. It's my way or the highway. You are there to make progress, and progress is incremental, and sometimes it's not as much as you want, and sometimes it's frustrating. But if you're moving the ball towards more health, more equity, that is good. And sometimes that ball moves not as fast as any of us want, but it is better to move the ball forward in that direction than to not move it at all and talk about how awful it is that the ball isn't moving. So that has been sort of my worldview. It also leads to a lot of people being very angry with me. They're like, you compromise on your values. I'm like, no, my values are my values. I got it closer to my values. You're right. I didn't get it all the way there.
And Dr. Ja, I'm Dr. Robertson, and I was the deputy of health in Florida during COVID and worked in the system and still do a lot of work in public health, especially in Republican states. And I agree with everything that you're saying. I was able to get a lot of health equity policy passed in Florida, and they're still asking me about those policies. So to your point, it's not that I compromise. I listen to the other parties. I make sure that it's sound evidence-based, and I figure out how we can work together all the way at the top. And I work with the governor a lot in the state of Florida during COVID to compromise on things that were evidence-based and for public health. So those comments were spot on.
Thank you. There you go. Like, there's a great example.
That was Ashish, that was Dr. Shamario Robertson. She's teaching communications right now in our program. I do know it's time, but I just want to thank you for spending the evening with us. I do want the faculty, staff, and students to know the integral role that you have played to develop this program. I will say that it was Dean Jha that had the idea, that wanted to build this program, that wanted to bring talent from around the country, around the world, to Brown, and to use the online modality to do so. And so, I mean, I know that it was there is a number of people that have played a role in developing and launching this program, but I do want to acknowledge that it was Dean Jha that had the idea, that had the conversation with the provost and the president to make this happen. So thank you for that. Thank you for being with us this evening. Any final message that you want to share with our students around leadership, public health? I'd love to just give
Well,
that.
let me just say about this program. I don't know if it was my idea or not, but I obviously am a huge fan of it. And my view has always been, we have extraordinary faculty. We have a lot to teach. We have a lot to share. We have a lot to learn. And if we say that the only way you can get a Brown education is by coming to Providence, Rhode Island, and doing it on our terms, well, that's not the school I want to be. That is not equity. That is not meeting people where they are. There are a lot of you who want a Brown education, but can't pick up and move to Providence for a whole variety of reasons. And saying that's the only way you're going to get it, I think is totally unacceptable. And that was the case I made to the provost of why we needed to do this. And by the way, this program has spawned the entire university to look at all of its programs and say, how do we make it more accessible to a much broader, from computer science to humanities masters? How do we make it more available and more accessible to a broader group of people? Because education should not be done on the terms of the educators. It should be done on the terms of the learners. And so I want to say thank you for going on this journey with us. You know, and as I talked about building great teams, when I was like, okay, we're going to do this, need a great leader to run this program, Jen Nazarino, and then Jen brought in Nitya, and we're like off to the races. This is an experiment. I think the experiment has been a wild success so far. My only last request to all of you guys, I am confident that we're not doing everything perfectly. So like, give us feedback. Every generation of students should have a better and better and better experience. This program needs to get better and better and better over time. We all need to get better over time. And the only way we do that is we hear from you. So thank you for being a part of this effort. Thanks for providing that feedback. And thanks for being a part of the Brown family.
On that note, everyone, thanks for being here. Have a good night. Thanks, Ashish. We'll see you all
Bye,
soon.
everybody.
Thank you to our
Take care.
moderators.
Thank you.